This is actually the midpoint of the CRE, and we've actually registered over 150 people. I'm very pleased that we'll have about 50 people here. You'll notice the room size is 45, but there'll be more people joining us tomorrow and some changes in those. And it really highlights, I think, the interest in TB control in Australia, that at this time we can have such a large group of people interested in the problem. We do have a couple of last-minute apologies. Unfortunately, Guy Marks unexpectedly couldn't join us for the meeting, and also Justin Denham, who was planning to come up from Melbourne, couldn't at the last moment. But we welcome a number of other people who've been here, some of whom may not have been to our meetings before, particular Andrew Burke, who's representing ACNet, and we're having a session this afternoon on ACNet, what it's done so far and what it will do in the future. And a number of people who've been involved in TB control for many years, particularly Rick Stapleton, and we're very glad that you could come. As we'll hear this morning, the Pearl project, which is based in the Pacific, will have lots of links with what Rick has done there in the past. I'd like to also mention that the CRE has an international advisory board. Most people probably don't know that. And we've tended to meet at the union meetings over dinner normally. But of course, we were not able to do that this year. So the board is made up of Professor Philip Hill from New Zealand, Professor Nung from Vietnam, Mario Reviglione, who is now Professor of Global Health in Milan, Dick Menzies in McGill, and Newt Longworth in the Karolinska. So we let them know the meeting is on, and Philip and Professor Nung will join us at different times. But we also had a very nice email from Mario Reviglione, who's interested in what we're doing. We hope possibly later in the year that we'll try and find a time which matches everybody and have a meeting with our board. Dick Menzies was not able to join us, but you'll note that tomorrow morning we're having a program with McGill. We're having two speakers from McGill and Greg talking about common research interests. And preceding that at 8 o'clock in the morning, we're having a Canadian breakfast. So if you want to come for a pancake and bacon breakfast tomorrow morning, you're very welcome at 8 o'clock here. So the program for the meeting is quite full, and for those who are chairing, we would really ask you to try and keep to the times. The reason is we have people who'll be joining us online, and we'd like to actually fit that timing as much as possible. I'd like to particularly thank Chris Prosser, who's the Executive Officer now for the CRE. We've had a succession of very good executive officers, and Chris is continuing that, and who's gone to a lot of efforts to organise the meeting. And also AV Prime, who are doing our kind of web link, which we're sure will work seamlessly, and particularly Armin, who is helping us there today. So one other point about the meeting, we are having quite a number of presentations because the fact that we haven't met for a couple of years, we really need to catch up with what's happening. And they are relatively brief so that we can have more time for discussion. So please try to keep to the time limits that you've been given. We're having two breakout sessions. The group here will be divided into two, and our Zoom groups will be divided into 4 Zoom groups who'll be meeting online, and they are to discuss issues following the program. One is today, one is tomorrow. The one today is straight after lunch. The reason is there's a different group that uses the lecture theatre from 1 till 2:45. So we'll be having lunch, and then Jamie will be taking a tribe over to the CPC building, and we'll have one in the boardroom here. And then this afternoon, we'll have a third discussion session led by Andrew around ACNet and research possibilities. So there'll be at least 3 formal occasions and then lots of other opportunities to talk. Tonight, a number of us will be going up to our favourite Vietnamese restaurant in Newtown for dinner, and if you'd like to join us, let Chris know. Okay, so before we actually formally start the program, I'd just like to highlight what I think are 3 aims of this particular meeting. The first one, as I said, is to give us an overview of where we are at the midpoint of the CRE, which started in November 2018. And so for that reason, we have really presentations which are actually following our CRE. Often you write research grants and get on and do your work, and then you get around to reading the grant again at the end. Quite the right way to go. But so we've organised the program around the 4 themes that we had. But the second thing is to actually think of new collaborations, both around those themes and other areas which have changed. And obviously something's happened since November 2018, which has affected most of us, most of our research, thinking about how we can adjust to that. And the third thing is to actually think of new opportunities for funding. Funding doesn't happen in a month. You have to be thinking about the grant applications we need to be putting in 12, 24 months in advance. And so this is the time now that we should be thinking of how to maintain the momentum in tuberculosis research in Australia in the future. Compared to when we started in 2012 with our first CRE, and now we've come a long way, but we've also got much further to go. And we should be thinking about funding not only in Australia, funding internationally from various sources, how to maintain the momentum. And I would say, I think to me, probably one area in the last year where we haven't been as successful, you should always look at the things that you don't do as well as the things you're doing, is that probably our training program is not as developed as it was in the last CRE. And there are various reasons for that because of, obviously, the disruptions. So we should be thinking about how to encourage other trainees, both clinical, scientific, public health trainees, getting them involved in TB research and supporting their career development. So that is one area which, although it's not formally in the program, I think we need to be always thinking about. Okay, so I think to stay on time, we should move to our program. You can actually get a copy of it on your phone, and Chris will tell you how to do that with the thing on the back. So if you click on that, you can... So don't get me to do it for you, just ask Chris. But you'll see that the program this morning is around our first theme, which was to find and treat. In other words, to be using every opportunity to find unrecognised, undiagnosed TB patients and treat them. So the program is around developing efficient and active TB case finding, new models of care to improve TB outcomes, and then looking at aspects after morning tea of cross-border spread, which was one of the components of our program. So we have 3 speakers who'll be speaking to us about active case finding strategies. And the first is Tuan Nguyen, who is the Woolcock Director in Vietnam, who with Guy and Greg is leading the Act 5 program.